Hi guys, welcome back. So we're back to Mastectomy 101, my YouTube channel, and I would like to just remind you, if you are happy with the content, if you could please subscribe to my channel. And again, my website is www.sistersforprevention.com. That's sisters, sorry my braces are acting up, sisters4prevention.com. And there you can find the latest information on the breast cancer vaccine, soon to go to trial, as well as read about me and what I'm up to, and also check out my blog. So we left you last time with my experience of the biopsies. So I had abnormalities in both breasts. The right breast had microcalcifications that showed up on the mammogram, and the left breast had a lump which did not show up on the mammogram, probably due to my fibrocystic disease, but it was found by my nurse practitioner when I went for a second opinion. So I've said this a million times, guys, but I'll say it again. You owe it to yourself to get a second opinion. So the biopsies were done. They were done on a Thursday, I believe. And although I was relieved to have the biopsies over, the weekend wasn't a very pleasant one. Of course, I couldn't stay off the computer, and I kept researching what could be, and trying to decide that if I did indeed have bilateral breast cancer, whether or not I was going to go forward with the double mastectomy. Of course, the medical community really discourages mastectomy if it's not needed. They try to do lumpectomy as much as possible, just because there's no statistical difference for survival between lumpectomy and mastectomy. So I had also found out from my research was that if I had stage 1 breast cancer and if there was no lymph node involvement, then if I did have a double mastectomy, there was a chance I would not need chemo therapy, and that was something I was very concerned about at the time, because I really had read a lot about that as well, and I was hoping that I could avoid that part of the process, you know, if it was possible. Obviously, I would do anything my medical team told me to do to save my life, but I was somehow hoping that, and praying, that I would not have lymph node involvement and I would not need chemotherapy. So I'm going to just keep going with my notes, you guys, so I don't forget anything. So they had told me when I had the biopsies, it would take a week to 10 days for the results to come back. So I sort of mentally prepared myself for 2 more weeks of internet searching and worrying, because by nature I do tend to have a worrying personality. So when the phone rang the following Tuesday morning, which was really only 4 working days since both biopsies had been taken, I knew that the news could not be good. So I picked up the phone, but the caller ID was Dana-Farber, and it was Karen on the phone. And she said, "I'm sorry to tell you this, but you do have breast cancer. And what we found in the biopsies, from the stereotactic biopsy of the left breast of the lump, we have found invasive ductal carcinoma." Now, invasive ductal carcinoma is the milk ducts are shaped like little round circles. And the cells, when they start multiplying inside, they obviously they're not supposed to be doing it, but they do. And when they have multiplied enough that there's no more space left for them, then what they do next is they go out into the nearby tissue. So they come out. And mine had already come out from the ducts. So she said that based on the fact that it was invasive, I was stage 1 at this point until they had the results from my surgical pathology. So this pathology we're discussing today is what's called the pre-surgical pathology. And what the pre-surgical pathology is what they find out from the biopsies. And it gives them an idea of what they are looking at when they go in for surgery, but it doesn't give all the answers. So that was the left pre-surgery diagnosis. Now on the right side, what they discovered was that I had, it's a little hard to relive a little bit, but okay, so on the right side I had 2 types of cancer. I had ductal carcinoma in situ, which means that the cells in that breast were in the ducts, but they were contained still. They hadn't broken out of that little circle. But they also found that I had lobular carcinoma in situ. It's hard to say with braces. Lobular carcinoma in situ means it went into the branches of the breast, or the lobules. And although it is still an in situ cancer, both were stage 0 cancer. Lobular carcinoma tends to indicate that the breast is not doing what they're supposed to be doing, and there's a good chance that I might have some cells, excuse me, in the left breast, which we wouldn't know until surgery, because they'd only taken a piece of the tumor in the left breast. They hadn't seen any other evidence of anything. And lobular carcinoma is also a bit more difficult to diagnose with the mammogram, and it was just by luck really that when they went in the microcalcification area, they must have also gone a little bit outside, and they must have taken a sample where there was evidence of lobular cancer. So the net result was that my fear of having breast cancer was now a reality. By now I had had quite a lot of time to digest everything. And I told Karen that the fact that I did have bilateral breast cancer, that it was a pretty clear decision for me that I was requesting a double mastectomy. So Karen said, well, you need to come in next week for the pre-op testing. Obviously the blood work and a chest x-ray to make sure your lungs are clear for surgery. And I would really appreciate if you would allow us to do an MRI of the right breast, just so we can confirm that there's no way to save it by doing a lumpectomy. I understand that she said, I understand that you have strong feelings about this, and we don't like to take healthy tissue, but it also would give us a good idea of what we're doing when we're going in there, since you're having a skin sparing double mastectomy. So I said, yeah, but I brought up my objections, and I said, I read that if I have stage 1 cancer and if I have a bilateral mastectomy, number 1, I won't possibly have to have chemo. Number 2, I never have to face that mammogram machine again. And number 3, the symmetry is going to probably be difficult to attain when, obviously, if I have to have a lumpectomy on the right side, I won't really know what to do with the left side until we do the first surgery. So I'm thinking it's going to require more surgeries for reconstruction. And she said, well, let's talk about that after we have all the facts. So what we did was we actually talked about what I was looking for in a plastic surgeon, so we could sort of get that going. So I was told, Karen told me that she doubted that I was a candidate for the deep flap reconstruction because I didn't have enough tissue in my stomach area to make it successful, and boy, I wish I could go back now because I think I have enough there. And actually, I want to let you know that when I was in treatment, they were only able to do the stomach or the shoulder muscle. And now there are specialists, very few, but there are specialists that can actually do your hip, use your hip fat and tissue to make the new breasts. And boy, I would jump at the chance to do that now. So she said, since it's not a tram flap, we have several doctors, excuse me, we'd like you to take a look at. And once you decide on your plastic surgeon, then the next step is for us to get you a block of time in the hospital OR where both your breast surgeon, that then Lesnikowski, who removed the breast tissue, could overlap with the OR time for your plastic surgeon to be determined to do what they called immediate reconstruction. Now, the term immediate reconstruction is a bit of a misnomer because at the time I was a bit naive. I had not gone to the plastic surgeon yet, and although I'd done some research, I had seen that they sometimes could put in the final implants at the time of the surgery. But I would learn later that I was not going to be a candidate for that. So the term immediate reconstruction is different for different people. So the next week came after many slow passing days, and I went in for my pre-op blood work and chest x-ray, which thank goodness came clear, and the MRI of the right breast. Meanwhile, I also met with the sort of the nurse practitioner staff that advises you what it's going to be like when you have your mastectomy. They prepare you. I received my pamphlet about it, the information about the drains and how to take care of them. Also, they gave me that hot dog pillow that I spoke about in another podcast, which was invaluable going home from the surgery to protect my surgical site from the seatbelt in the car. And they also gave me a post-surgical bra, which when I would have the surgery, they explained that I'd be bound up with surgical tape, and they would put a bra on me for surgery, but that as the swelling went down, I would need additional clothing. They also gave me a vest with pockets, which would hold the drains while I had them in, so they wouldn't be sort of just hanging from my side. And I talk at great length about this in the other podcast. And they told me I would be in the hospital overnight at least, and that as soon as I was able, they wanted to get me out of the hospital because obviously they're afraid of, of you catching something and I'm flying here, catching something, and they want to get you home as soon as you can. Now I was a little concerned about that because I lived an hour and a half from the hospital, so I was in my mind thinking, gee, I hope they'll let me stay a second night, and it did turn out that way. But normally, believe it or not, staying overnight is the typical protocol for mastectomy, which I think is horrible. In the previous decades, you were in there for 5 or 6 days, and particularly if you have to go home and take care of yourself, you're in no shape to do anything when you first come home from the hospital. But so anyhow, we had calls from friends, well wishes, and of course explaining everything over and over and over again was really not something I wanted to do. I was anxious to get this show on the road. So the earliest date that they could arrange for me to have surgery was February the 6th. And there were 2 surgeons that were available that day. There was a gentleman surgeon, and honestly I don't remember his name, and there was a female surgeon. Her name was Stephanie Caterson, and she had been trained at Harvard. So I read both of their bios, and I decided on Stephanie. And so Karen made the arrangements, and so this is still the beginning of January. So since I wasn't going to be having any surgery for at least 3 weeks, I asked, could I go to Florida, to my condo in Florida at least, and get some sunshine for a bit and then come back for the surgery. And Karen said she didn't see anything wrong with that there was no reason that I couldn't do that. So I did. I bought a ticket and I went to Florida, and I was lucky because I had a week there before I received a phone call from Karen saying that there was an opening for January the 30th, and if I wanted that slot, that I could change from my first week of February appointment to January 30th. And I was like, yeah, let's just do this thing. And so Stephanie Caterson was also available as well. So I flew home, and then I went to Boston and met with Dr. Caterson at her office, and she did the pre-surgery pictures and explained the whole procedure to me. And I again checked with her again if she thought that my best option, due to my size and the type of cancer that I had, was still going to be implants. And she said yes, that to get a good result, there wasn't enough tissue in my abdomen area to get a good result. So we were going to go with expanders, which are like, they're basically implants that are flat, and they have a port on them, a metal port, and they put them in at surgery, and if they can inflate them a slight amount. But basically what they do is you go back for fillings, and they keep injecting the saline into the ports by using a magnet to find where the port is. And when you are, and then gradually expand your chest so that there's enough area to build the pockets for the real implants. Now I was having what was called under the muscle reconstruction. So they basically take your chest muscle and pull it out and gradually stretch it over the period so that you can get the size that you like. So I was very comfortable. Stephanie was lovely. Her assistant Abby was an angel. I would call Abby my angel. And they made me feel totally at ease, and I was totally at peace with the whole decision. And quite honest, I couldn't wait to get this cancer out of my body. So all I can tell you is you get through it, and somehow you get the strength. You don't know where you get the strength from, but you get the strength. And that's all the support I received from my family and friends, and prayers, and I'll be forever grateful for all of their support. So I'm going to end with this, and I am happy to answer any questions. If you want to send me your questions or post questions below this video, please remember again to subscribe to my channel. I'm going to be doing some live posts, so it would be really nice to meet some of you and to have a bit of a chat going back and forth. And check out my website, www.sisters4prevention.com. Read my blogs, check out what's going on with the breast cancer vaccine, and I'll ask you for one more favor if you feel up to it. At the top of my website, in the top left corner, there is a box which is WeGo Health, and I have been nominated for a position with their program, which would give me access to a lot more advocate opportunities to advocate for women with breast and ovarian cancer. So if you could click on that and give me a thumbs up on their website, I'd really appreciate it. There's several categories there, but most of my points are in 3 top categories, so I'd appreciate if you could take a look there as well. And till next time, till we meet again, stay safe, stay healthy, and may God bless us all. Thank you.